the ACES Optimist Show with your host, Dr. Craig Morris.
Hello, everyone. Dr. Craig Morris here. Welcome to our ACES Optimist podcast. We're dedicated to optimizing human potential in the clinic of life. Today's guest is Dr. Shane Lawlor, and he is a great friend. I would say he's a protege. And the interesting thing about proteges, they also are like mentors in that we learn from each other. And it's kind of a circuitous route how we became introduced. So please welcome Dr. Shane Lawlor.
Thank you very much, Craig, for having me.
I was going to give the audience a little bit of a background of how we became introduced as we move forward. It gives a little bit of a foundation. And in 2010, I was invited to lectures in Australia, a series of lectures, and one of them was in Melbourne. I was invited by Dr. Wayne Minter. Some of the chiropractors, especially in Australia, would know. He was an initial DNS international instructor and then later became an overseer of standards and practices in Australia and still, I believe, serves in that capacity. So I went down to my final lecture for low back disorders and was teaching a Melbourne course to a group of chiropractors and osteopaths. It's interesting because they have an association of both. And while I was discussing rehabilitation, a chiropractor came up to me and introduced himself as an expert in golf and had a golf group. And we started talking, and all of a sudden we became interested in the idea of collaborating together. And all of a sudden one thing led to another, and I was involved while lecturing in Melbourne. A doctor came up to me and introduced himself. His name was Dale Richardson, and he was in charge of a group of clinicians who took care of professional golfers on the PGA Tour and the European Tour. So one thing led to another, and all of a sudden I was a part of this group. And that led me to meet Dr. Shane Lawlor. But it turns out that wasn't the first time we'd actually become a little bit acquainted. So Shane, maybe you could take it from there.
My final year in the Welsh Institute of Chiropractic in the UK, Craig was kind enough to come and speak to our college. I'm guessing David Byfield probably invited you, but I'm not sure. I can't remember who introduced you. It was probably David.
Yes.
And I was sitting in the audience, and you were going through your lower back syndromes book, which is an absolute, well, I would call it a beast of a book. I know it took you probably a decade to write. If I can't remember the background in terms of, but I know it took you a long, long time, and then to be able to pull that number of authors together to put that piece of work together, it was massive. It's a big coffee table book, and you're not going to read it in one go. I don't think I think because there's quite a lot of students at your talk. I'm more or less, I remember the place, it's not going to be there anymore. We've just opened, there's a new clinic in Wyock, or the Welsh Institute of Chiropractic. That room would have been in our old clinic building called CC1, and I'd say it was a full house. So I don't think you actually got to spend much time with the students because it was more or less a theory-based talk that you did. And lo and behold, let's go. So it's 2006, so 4 years, 2000. So 4 to 5 years later, who would have known that we were going to be sitting in the same room, having not known each other, but been probably 10 foot from each other a couple of years before.
All right. And you're right. It was David Byfield who was he was an author, a lead author in one of the chapters, the posterior joints chapter, along with a few of the other instructors there. They contributed one of the chapters to my textbook. And so as the head of the Glamorgan School, he invited me to do that lecture. And that was a nice large group. I really appreciated his invitation and the opportunity to talk about my book back then. So then all of a sudden we're teammates. We're working together with a group of, I would say 25 of the top golfers in the world at that time. And in that group, you were my senior because you had been with the group for already a year. But these Optimist podcasts, they're for everybody to look at how they can improve themselves, because improving yourself and taking on the challenges is what helps make life interesting and worth living. But you got into this and you were chosen to be in this, what I would say, a very elite group to work with top professionals very early on after just a few years in practice. So I thought it might be nice for the audience to learn a little bit about how you were chosen to be a part of this group and the impact that it had on your personal and professional growth.
Yeah, it was very fortuitous, really, in terms of timing. I was a junior member of now, do we call it a defunct organization or did it evolve? Effectively, the British Chiropractic Sports Council, so B.Sc, had full members, and I was a junior member. And Karen and I came back to Ireland in 2009, and lo and behold, I think in February of that year, I got an email from Dale, not directly to me, but it was to all the members of the British Chiropractic Sports Council, looking for somebody. And I can still, the things you remember, crystal clear, the list of things. Dale was straight to the point. There was no fluffing around what he wanted. He wanted somebody that had one of the first things he wanted was active release techniques. And I knew, looking at when that email came, I knew that there wouldn't have been a high number of people that would have completed the training with ART. And then he had 5 years experience. I had 2.5 years. I was like, okay, that's going to count against me. And then the third was an interest in the Titleist Performance Institute. From there, I think he cut it. I don't know how many people he interviewed. I know previous the year he had looked at a few other chiropractors that didn't work out for various reasons, because Craig knows as well as being on tour, there's a personality thing in terms of gelling with multiple, as you said, there was 20 something players, so that they all have different personalities. So some probably very experienced chiropractors were interviewed and just didn't gel, maybe with Dale or with the players. And from then I had a formal interview at the Irish Open in 2009 at the Baltray that one of my future clients ended up winning, Shane Lowry, as an amateur. And I mean, as interviews goes, it's tough in one way and tough in another. I remember Dale handing me some earplugs. We were in a B&B. He goes, I snore. I was like, oh, great. I was already nervous enough, so sure enough, I had to use the headphones or the earplugs. He did snore. And effectively that week was just pull back the curtain, what it was like to work on tour, the hours. And then I know there was a couple of times where Dale got me to work a little bit on the players, small bit here in terms of like calf and forearms.
You bring up a good point on personalities and working with golfers. I had already worked before that with powerlifters and worked with the World Powerlifting Federation and World Championships. And then later on, I was involved with National Hockey League with teams. And what is interesting to me in this topic is the different types of personalities among the different athletes, and also because of the organizational setup, I would say. For example, National Hockey League, they're team players, and they're professionals. They're pretty well young. They're guys in their 20s, usually earlier 20s, and they look very much to their other teammates and to their coach, but especially to their trainer, to their general manager, and they also have an agent. And so it's very much, when you're working together, it's a very much of a team strategy in assessment and communication. But with golf and golfers, for the most part, they're pretty independent guys, each one for themselves. And so you don't have to get along as well with, for example, individually with a hockey player, because as long as the team says to go there, you follow what you've done. If the other players, the teammates say it's okay, or then, you know, you don't have to really connect that well. I mean, it helps, but it's not necessary. So necessary. With golf, they're so independent, each one of them, that you have to really establish a personal relationship with each of them on their own, because they make their decisions who they're going to sign up with, who's going to take care of them very independently.
Yeah, because as you said there, the agents agents do, as we were signing more and more players individually as we went on tour. Like when Dr. Jesper Dell from the UK was hired, he was interviewed the week after me, and Dale happened to keep the two of us together. But back to in terms of the personalities, the agents didn't really step on our toes. They'd only negotiate in terms of the contracts of the service that we're providing, but the players was either or out the door.
That's right. That's the it's very different, the dynamic of different sports, and you have to be able to fit within that and make that work in order to be able to accommodate them and team together with them and establish that working relationship.
For me, I don't get the questions as much anymore because I don't travel full time, but I remember when I was first, like from 2010 all the way to 2019 when I stopped traveling, every week I get young chiropractors asking me how do I get on tour, and like the hardest thing is get on a tour, and obviously Dale gave me the golden envelope or the golden ticket, like Charlie and the Chocolate Factory, in terms of being a winner. But effectively Dale said you have 3 months to prove yourself. So if the players don't like you, you're gone. And how it progressed from there is in 2009, when me and Jesper interviewed, Jesper started straight away because he had a hell of a lot more experience. So I was lucky I had Dale and Jesper to learn as much. I mean, I was like a sponge. I was, as they always double listen and shut your mouth.
Yeah.
Just get, I was very lucky because Dale and Jesper looked at the body slightly differently, because Jesper would have been from an SOT background. It was nice to see their different viewpoints, or like changing glasses is how they would work, and we had a central point of what we would do with the players, but the lens that they viewed the players was slightly different. So I got on the job in the trenches, mentoring straight from the beginning. And
so let's go back a little bit. Let's talk a little bit about the foundation that led you to this, because I think that's very important. There's by the time you got on tour, by the time you became part of our group, which we called Pro Golf Health back then, and you started touring the world, taking care of professional golfers, you had already decided and trained, so you were certified in ART by the time, right?
Yeah.
But what would you say were areas that led you to looking towards sports, towards excellence, towards investing in yourself, and that you feel helped you be able to gain that? Because there were many people who were trying to get those positions. What was it that you felt you had, or were there mentors that helped you become sufficiently established to make get that position within Pro Golf Health?
That's a great question. I don't think I had too many sports chiropractic mentors in college, but obviously I have to thank everyone, those mentors that made me question. I always remember Ali Pedersen. He's retired quite, but I always remember he's a Danish chiropractor. And I for whatever reason, during my final year, I presented quite a number of our numbers are 4,400, so we had 40 new patients, so I had to present 40 cases. Well, I didn't present 40 cases, but I spent quite a chunk. And I always remember one thing, he'd always push you to look further and look at funny conditions. And I remember the first and second year of college, I didn't like it. I couldn't see how this boring neuroanatomy and all this palpation was but then when I moved into third and fourth year, okay, the penny was dropping, and then I really enjoyed fourth year.
Because that's when those later terms, it starts to all come together, blend together, and it all of a sudden becomes practical and relevant.
Yeah. So then I could start tying, that's how my brain worked. I started tying, and I found certainly the third and fourth year a lot easier. Clinic was really good fun, and I'd always try and read as much as possible I just always had a hunger. I think it probably even goes back to when I was a kid. My mum would always buy me a book every month. I always remember the Scholastic magazine and coming to school, and I always liked science. Uh, ART was probably, I was very lucky. One of my colleagues, he's based in Finland. His dad's a chiropractor, Nick Bliss. His dad, Fraser Bliss. I don't know if you've ever met Fraser, have you?
Not that I recall.
Fraser was a Canadian chiropractor. He's been in Finland for a long, long time now. It could be close to, well, I graduated 19 years, so it could be 30 years. So you mightn't have crossed paths. But Fraser sent Nick to do ART in our third year of college. And I didn't know what it was. So I guess Nick indirectly did ART on my hip. Was one thing I remember. He did ART. I was a student patient, and he did ART. I'm like, well, I need to get on this. The first course that I probably did that made a massive impact on me was I did Stuart McGill's. Now it would be his level 1 course now in terms of his delivery, but it was just one course back then. I remember going to Birmingham, and we'd been shown some bits in college, but then watching some, like I've been really, really lucky as we go along, but I've been really lucky to have met some probably the best rehab specialists, hands-on people in terms of by luck. And I shouldn't really, because I'm from a small college in Wales, shouldn't have no, but having seen Stuart in my final year, and then I started ART the year after, so I got to meet Mike Leahy, who I mean, he's donated his so much of his professional life to learning and the now the changes in fascia research, and we're still not quite close to knowing what's happening underneath their hands, but we all know that good manual therapy can have a dramatic impact on our patients, plus the athlete. And then in my case, it was the golfing athlete really liked ART because you could do ART and then they could go and practice and there wouldn't be any soft tissue soreness when applied correctly. Because it was very easy if you go in and all hell for leather and hurt them, and that's game over.
Right. There's no future in that. They have to be able to get out there and be able to play and be able to compete. And they have to have confidence that you're gonna help them be better to be able to succeed, because golf is unbelievably to say it's competitive is an understatement, but it's really unforgiving. And this is true with all of the athletes in sports, but especially because you
have no guaranteed money.
You have no guaranteed money. In fact, you have outlay of cash to be able to get out, and before you hit your first ball in a tournament.
Yeah, you're paying your agent, you're paying your caddy.
That's right.
You're paying your travel. I mean, and even like golf still is, and we all know what, I mean, it's unfortunate what's happened with Liv, but Liv is the exaggeration of that. But the normal PGA Tour, European Tour, it's an inverted pyramid. So the higher you're up the chain, the more money you're making, but the less you're paying for. Because back in the days when I was on tour in 09 to 19, the best players were getting paid to play those events.
Why don't you explain what Liv is? Not everybody's going to know that.
So we saw when I was finishing up in 2018-19, the Saudis were coming into golf. They started some events, and effectively the PIF, which is the Saudi wing of sports, they more or less set up their own rival golf league.
Rivaling the PGA
Tour, or trying to.
Yes.
And they were innovating golf. What they were trying to do then is make it sexier and more applicable to the younger generation. And they floated a lot of cash in front of some big names and players that you and I have worked with. Some were in the latter stages of their career, so they were getting a nice Graham McDowell, Henrik Stenson, Louis Oosthuizen's players we work with, Charles Schwartzel.
Yes.
Peter Uline was a long-term client of mine for a couple of years, and
we worked together. I worked with Peter and you with him.
Yeah.
Together. Yeah.
So I can understand for different reasons. Some of the players left because they were on the latter page of the career, so they got cash up front. They were paid lots of money, and then some of the players like Peter, it gave him security for his family. And then they were trying to pick up some young up-and-coming amateurs as well. Some have done okay, some haven't. I still believe that despite the money, the viewership in Liv is not what the PGA Tour is, not moving the dial. And effectively, too, the other thing is Tiger Woods is the one that moves the dial, unfortunately.
Still.
There's no, like, that's what they are. Tiger is 50 next year, I think, if I'm right or wrong. It might be. No, I think he's 50 next year. He's
I think
close to
right.
it anyway.
I think that's right.
They are praying probably on the PGA Champions Tour that Tiger's going to come out and play some events because everyone wants to watch him.
Of course.
Even if he plays the ugliest golf ever, shoots 80 something, they don't care. He just moves the needle.
Yes.
Yeah. And then
we've been very fortunate as a profession,
yeah.
Because he really helped us around the turn of the century.
Yeah.
He was I think he was still an amateur player.
Yeah.
But he was just getting started, and he was on the float. Chiropractic profession had a float. Yeah. It must have been 1995, maybe during our centennial year at the Rose Parade, and he was on our float way back then, which was really a big thing. And he was already had some sort of name and was on there, and that just helped to boost the profession as we were turning the corner into a second.
I mean, how many chiropractors still use that picture of Tiger and his quote about chiropractic treatment? And some of those chiropractors have been nowhere near a golfer, but they like to put it on in terms of, look, we know chiropractic, but to me, chiropractic with treatment, with soft tissue work and rehab is the chiropractors that are treating the golfers, not the just manipulation only. And then in terms of mentors, then look, we were very lucky that Dale asked you to join the company, and then of all the lads, all the guys on the team, well, for Ireland I would say lads, but the guys on the team, we were lucky you introduced us to, probably in Redondo Beach, Santa Monica. We had to talk, so I remember we were down in a hotel.
Yes.
You introduced to DNS. Now we were not introduced to any DNS, and obviously you were one of the innovators with the Prague School to bring DNS to the Western world. There's obviously a longer history that you spoke about with on Craig's. In general, to the normal chiropractors, we weren't seeing DNS, but you introduced it to us, and then we were very fortunate that you brought Julia, who I've seen recently in the DNS elite course in Prague. One of Julia's first courses, she came and taught an A course with, I think it was only about 9 practitioners at the time, and Mike Rentala was there. So I was very lucky, and I've obviously seen the evolution of DNS since 2011. I think was the first time we had a formal course.
Yeah.
So you ended up being a massive mentor indirectly, or as in by accident, ended up being a massive mentor for me, because I think I'm the only one of the team that completed the DNS and
became certified DNS clinician.
Yeah, clinician and trainer. And I've more or less, bar 1 or 2 years, I've more or less done at least one DNS seminar every year. I think it's very important to look, Stephen Covey says sharpen the saw. I think it's really important. I think too many young clinicians now, they're graduating and they've so much options, but they're dipping their fingers into 1 or 2 things and they're not mastering anything. So I was lucky when I graduated from college, I started doing ART. So that boom, I was straight, fully immersion in that. A little bit of TPI, functional movement screen, and then DNS, trying to integrate all that into my practice style. And as you said to me, Shane, you're really good at, I remember one thing, conversation said to me, Shane, you're probably going to be very good at the treatment of an area, so shoulder or neck, but let's start developing your clinical eye in terms of looking at the body in a global system. And we know that the DNS lens does allow us to look at beyond just breathing, or that's probably one of the big misconceptions. It has a lot more uses than it's just belly breathing and pressurization abdominal.
Well, when we started our courses with Professor Kolaj and Professor Kovasova, now they're both full professors.
Yeah.
It was developmental kinesiology according to Kolaj, and he was looking for a name.
Yeah.
And it was that kind of that gestalt, that whole idea. When he asked for a name I'd been thinking about, that's what led me to recommend the name of Dynamic Neuromuscular Stabilization, because of what we were doing was really stabilizing the whole body. And like you were talking, instead of becoming a master of different little parts, to be able to put the whole thing together, because the concept of stabilization is so complex to really understand locomotor system stability. And that was really that topic was really brought forward to me by Professor Yonda. And he was talking about, because he talked about an unstable low back in his lectures and what that encompassed, which we still don't fully know, but we're gaining more and more understanding of it. But that's really what we're after, and that's what we're doing with our model. DNS is stabilization. And now we see that this is even now with our name and with the topic is continuing to grow. Dr. Peter Attia's new book on longevity, which is a bestseller, and I think I heard that there's over 3 million copies sold. He was just on 60 Minutes here on CBS in America a few weeks ago.
And Outlive is in, like, we're in Portlaoise, a small town, and there's 2 bookshops here, and they both have the copy of Outlive is on the shelf.
Yes, and so he's I think it's chapter 5. He's dedicated to the topic of stability.
Yeah.
So as a result, so this is the impact that the Prague School is having in the world of rehabilitation, and so it's nice that we're all of us that have been affiliated with the Prague School have had and been able to impact that global model of rehabilitation. So then with you became certified as an ART clinician, but that still wasn't really fully sufficient. You ultimately became an ART instructor.
Yeah.
And so, and one of the things, and I think I've said it in prior podcasts, when we become instructors, we become professors. It's because one, we want to share the information because we feel it's important and we're passionate about it. But another is we're still looking to grow. We're still looking, and so by taking these courses, we're looking for the questions that we haven't yet considered. We're looking for people's their own stories, their own histories. So it's another part of continuing growth, and this is one of the things that I really saw in you all those years ago now, 15 years ago, really. This curiosity, this enthusiasm, this incitement for looking to grow, to gain. You were very pragmatic, and you had great questions. And this is one of the things I think we want to see and are looking to see in today's students and young clinicians, and that you're in that way, a great mentor to us. And now you've also, in your practice, you've grown and established your practice here in Portlaoise, now in Ireland, outside of Dublin, about an hour outside of Dublin, and you practice with your wife, also a chiropractor, Karen. Tell us a little bit about your practice and how it's evolved, how it started and how it's evolved.
We were probably the beginning, I think Karen started DNS after me, but in the beginning we were both ART chiropractors with some rehab knowledge, and it's amazing because there had been chiropractors in our town before, but they'd burned bridges and gone. So I think a lot of people didn't know, like, chiropractic's still unregulated in Ireland, and I don't think they knew what to take of us. And then we were spending a lot more time than the 5-10 minute visits, because Karen and I, we knew from when we set up our own clinic, it's got to be at least 20 minutes, if not 30 minutes, if we don't have a receptionist with us. So in terms of yin and yang, Karen and I do all the same things, but I'm very lucky to have her as a mentor now, because she has finished DNS pediatric track, and to me that's the hardest one. I think the clinician is hard, strength training is hard, the trainers are hard, but if you can finish the pediatrics, DNS is a cakewalk in terms of, and then some of the cases that she has to see, like I've seen her, we obviously, same in America, you can't diagnose some of the kids coming in, but she knows based on the thorough examination that the Prague School has laid out on top of her chiropractic testing. Some of the cases she sees now, I've seen kids coming in with disabilities, and within a couple of weeks, if not months, they're walking and they're ambling, and it's like the dark arts, and the parents are a bit shocked in terms of the integration of DNS. I think a lot of people assume, she's just going to treat them for colic or reflux, and she's going to do an upper cervical manipulation or use an activator. But Karen and I were lucky that when we were introduced to DNS, that the voida therapy was included, and certainly was heavily influenced in terms of the pediatric treatment. And we've had Eastern European patients now coming to clinic, and they know what to expect.
All right, and there's nothing wrong if you're a chiropractor, for example, who's doing manipulation, and very often with the pediatric, with the children, just as with adults, it can be extremely beneficial.
Yeah.
But there are times where there are more complex cases, and they simply will respond better, quicker, or make longer gains, and that tie in that the DNS pediatric model and the Prague School model for rehabilitation is absolutely critical.
Like I'll use a good example. One of our associates who's gone, he had one of my patients that he saw for me. Their son he's autistic, nonverbal, but the mum wanted him to look at the child's. He's older now, but he's a teenager. But look at he was on his toes, and I'm like, hey, you don't know anything about, like, that's a reflex, and like that. I mean, that case went straight to Karen. But in terms of that's where DNS would give me a different eye. I think in the past, if I was just a standard chiropractor, I'd probably mobilize the feet and see if I can loosen out his calves. With looking at how the central nervous system impacts a child with autism and central coordination and other issues that they have. I think the hard thing about DNS, it is very, very hard to integrate. And yes, it doesn't have a cookie cutter. We were talking last week about before this, and I was even the notes have changed so much. So the original notes that you would have given us in 2011, the A course, every year there seems to be updates, and it's tweaked and changed, and it has gotten a little user friendly. But I think inevitably, compared to other techniques, if you're going to go down the rabbit hole of DNS, you have to play and fail, or be not scared to fail. You've got to try the positions and try and see if you can change your therapeutic goals in terms of using DNS. And they mightn't bring you to where you think you're going to bring the patient, but your ability to play and see. I mean, you've seen Pavel a lot more than me, but it's quite an experience watching him with an athlete, or when he does a Carl Lewin on it and says, I don't need their history, I'm just going to examine them, and he's like, oh, you had knee surgery, and he didn't even look at the front of the knee, but he knew. So some of these.
Right. Well, I like to say that Pavel is, in some ways, he's a poor communicator, because a lot of times he doesn't explain what he's doing as he's doing it.
Yeah.
But it's a paradox, because in other ways, I think he's the ultimate communicator, because instead of necessarily going to the history and having a long conversation with the patient or their clinician, he essentially goes and talks to their body. He tries things. He understands the body's reactions, and so he tries small things. He looks at their posture and their movements, some of the things that he learned from Professor Yonda, and then took that in further, and also from Professor Levitt and Professor Wojta. And DNS really is a compilation of their life's work. And then he'll go and he'll start working, or he'll look for a certain response that he needs. And so you're watching him, and he'll all of a sudden go, yes, that's right. That's exactly right. And those that are watching go, what's right? What just happened?
What's he talking about?
That's right. And so that's part of what we're learning, is to understand what it is he's saying and why. And this is why, when we first started, I took 2 courses with him back in the early 2000s, one in Prague and one in Bournemouth, England. And I thought it was brilliant, but I had no idea what to do. I had no idea why he was doing it. I couldn't understand it, and I don't think anybody in our class did. And it wasn't until actually I brought him out. I asked him, he told me he needs 5 days to really explain it. So I brought him out in 2004, and that was the first time we got a foothold where he could leave and we had something to work with and grow with. And so it's that his unbelievable ability to communicate and to listen to the body's responses, to provoke them, And so he's giving these small little cues, little stimuli. And as a result, saying, oh, and that's then giving him a foothold to be able to then start to see where the problems and where are the key links that he needs to go after to change. And but it takes a while when you first see him to figure out what's going on.
It's like the one thing I'd say, having like I've met your practice so long, when you see people like you, or even Brett's probably going towards that
Brett
realm
Winchester.
now. Yeah, Brett's going to that realm. Because I was lucky enough, Brett invited me to his clinic. I was at the Masters one year, and then I was flying up to Chicago for an ART seminar. He says, come and hang out. So what does annoy me sometimes, you see instructors, it doesn't matter what technique it is, and then you hear stories that they're not actually doing what they're saying in their lectures or their course, and they're not actually doing it in practice. But everything that Brett says in his courses, he is doing in practice. So it matches. There's a lot of some with the social media now. There's a lot of barking, and I don't think a lot of these people are actually. It takes years for clinical mastery. You do have to put the hours in, and what I have found, having spent time with you and Pavel, Mike Leahy, Stuart McGill, even though they've different techniques, if we put the same patient in front of them, Craig Liebenson as well, one of your colleagues, but in terms of, you see those guys with all that experience, and yes, they're swayed in terms of their different journeys, but inevitably, even though they might have different viewpoints, they generally come to the same conclusion when you put the person in front of them. And that we can call it a clinician's eye or the coach's eye. That is really hard to, there's no shortcut for that. And you really have to get the repetitions or the at bat for your merit. I like all sports anyway, so, but you need to get the at bats. There's no shortcut. I wish there was. I think sometimes we feel like we're chasing the unicorn, but you have to put in the work. I was reading a newsletter I get I think it might have been the knowledge project, and this is where I think some of the young clinicians are failing at the moment, is don't assume that if you go to a course once that you're going to pick up 100% of the material. If you pick up 10 to 20% of the material, that's right. Good, and then you come back again. Like I'm trying to think even the time now, how many.
It's especially true with DNS.
Yeah, because it's going to evolve. And then, you know, as well as I have, we've met near. I think I've had nearly every instructor. Maybe some of the US ones I haven't seen, but I've seen them speak on YouTube, and they, even all the Prague physios, their application. This is the amazing thing. Their application of what they pick and choose. It's not that they pick and choose, but their application of DNS is slightly variant. So there's little bits of gray Venn diagrams, and that's okay. People get a bit annoyed with that, but that's okay.
That's exactly right.
There's no problem with that.
That's right, because people have different interests, they have different focus, they have different skill sets, they learn differently. So as a result, when you see a variety, then you find out, you know, what combination fits your personality, your intellect, your patient base. It's 100% right. And every time that I would co-teach courses with another DNS instructor, I always learned. And I had a course recently in Buffalo, New York recently, and we had a certified DNS clinician there. You're supposed to, at this point, you're supposed to take one course every decade just to maintain your certification, which is very, very easy. But he takes multiple courses annually, and he came to the A and the B courses that I taught, and you see his passion and his continuing growth. And you know, you'll find that each instructor will have their emphasis, their bend, their take, and he understood. So he looked, and that was why he was there, and he was a great benefit to the course, because he's probably somewhere about your age.
Yeah.
And I drew upon him a lot to say, what's been your experience as you've come along, and things that I would ask him, because that would give the students more understanding of, you know, this is not necessarily like some courses where you took it once and then you don't need to take it again. You'll learn, because as I said, it's like, especially with DNS, it's like peeling an onion. So you get the first layer out, and then you can see what's beneath, and then that leads to new things. So you take the courses over and over, and you take different variations, you continue to grow, and that really helps to define DNS.
Yeah, even like last October, I did the strength training 1 course. We brought Jakob over to Dublin, and that takes a lot of the development kinesiology is kind of in it, but not in it. And then what I really liked about it is we this is the progression of DNS, is where, let's say today I was doing a bench press in the gym, and one of the things Jakob said, look, it's much safer instead of going through a powerlifting or letting yourself go into extension, that you DNS, you do a DNS bench press. So you bring yourself up into, say, 4 or 5 month position, and you're pressurizing the abdomen. It makes a massive difference in terms of this way. And
Yes.
There is a big difference in terms of, you can be we know there's plenty of chiropractors done certified strength and conditioning courses and CSCs, isn't it? Or what's it called? Certified
Strength and conditioning coach.
Yeah,
Yeah.
that equivalent.
Right.
We all know you've seen a lot more athletes than I have over the years. They could be great in terms of their strength, power metrics, but their actual motor control or their control over the movement is really poor. So to me, getting that bridge, that's where I think DNS feels like us as clinicians building a great foundation for that patient or athlete, or depending on how far we have to bring them in terms of how elite they are, and still applying the DNS principles if it was baseball or basketball or whatever sport you're looking at. People get stuck, oh, I have to do all this exercise on the ground, but you don't. You have freedom to be an artist with DNS. I think that's what people forget.
Yes. Another point that I'd like to point out was my role with Pro Golf Health was not typical, but very often I think in our professions, and it doesn't have to be just chiropractic, it can be in physical therapy, physiotherapy, or other healthcare models, that there's only space for one chiropractor, for example, on a team or in a group. So when I came on with Pro Golf Health, I didn't have a group of golfers that I took care of and traveled the world with. I was there to instruct and teach rehabilitation and sports rehabilitation to all our group. And I also then would take different golfers, one of our golfers, and go and travel with them and work with them for a week and work on stabilization, different strategies, and team together with their treating clinician, you or a couple of clinicians that were working with them, so that we team together to try to improve their overall posture, movement, athleticism. And so I had a different role. We were both chiropractors, but we had different roles within the team. The same thing occurred a decade before when I was working with the National Hockey League, as I was working with and contracted with teams in Florida. I was in Los Angeles, and there was a local team chiropractor who was diplomate in sports chiropractic, who was taking care of day-to-day work. But if they had complex injuries that no one was resolving, and they had a team of orthopedic surgeons, physical therapists, massage therapists, athletic trainers, and if they weren't pleased or they weren't coming along as they wanted, my job was to take care of them. They'd fly them out, and I would take care of them. So I was really more the director of rehabilitation and complex cases, case management and integrative. And then I would then have 5 days to work with them and get to the bottom of them, get them improving, and then send them back with a treatment plan for the team back home. And so I think that it's important for us to not, I think it's almost disrespectful of any profession, including the chiropractic profession, to say, you know what, there's a team chiropractor. Because as if we are so limited in what our capacities are. We've taken all those years of schooling and training, and then to just say, well, they're the manipulation guy or clinician person. And I think that does a disservice. And it's the same, I would say, if there's a team physical therapist or physiotherapist or athletic trainer, there's areas of strengths and benefits, and that's what led both. And you exemplify that because in your clinic, you have also physical therapy. And so you guys team together. In the end, you do what your interests and where your strengths lie. Your wife does the same thing. And at times there's overlap of treatments and therapy, and that's fine. But there's also the same with the physiotherapist there. But at times they have an area or they have a certain strength or additional training, and that just it's our collaboration, it's our teamwork, our blending together that leads to a greater benefit because we're talking about patient-centered care. And so what works
not ego-centered care,
not egocentric, not clinician-centric care. And this is where I think hopefully as we move farther into this century, we start to get great lower barriers between groups or ideologies, and instead more collaboration for their patients.
Yeah, I think when you dropped it, like, it's funny, the chip on the shoulder that some young graduate, oh, I want to be the best chiropractor. You have to build it. Like you said, there's really important. That's one thing, the mottos of the Titleist Performance Institute, which have done all their courses. You build a team around it. Like, I can't know everything. I've asked you questions on cases over the years. I've asked plenty of, sometimes I need shockwave. We don't have a shockwave machine in the clinic. I'll refer out, or if I need help of a hip surgeon, I like, that's the network I built over the years. I send directly to the surgeons now. I tend to skip the GPs and just save them some time, or the general physician in American terms.
Yes.
The better network you build around you, and then there's people that will do much better with a good guided strength and conditioning program, but I effectively get them back on their feet. And you have to, you can't be a one-man band. I know I can't learn everything now at this stage, because when you start having kids, the window gets tighter in terms of the amount of hours that you can put towards your continual professional. Like, I used to do 150, 200 hours every year, plus the golf travel before the kids came.
Right.
So now what I'm trying to do is make sure that even though I mightn't be at the courses, to make sure I'm spending time reviewing notes or new notes that are made available to us from all the different techniques.
I think it's great. My philosophy when I graduated chiropractic school, which was in 1981, was that now I feel like I have a foundation. My education at that point gave me a foundation from which to begin to really learn. And you are a living example of that, because you've taken all of these courses you've talked about, but then I remember a few years back, you decided to pursue a master's degree. And so this is not something that you often see. So what was it that led you to that? Because this is the kind of areas of excellence that I would really like our readers to be able to tie into as they start to, especially for our students and our beginning chiropractors and clinicians, where our broadcasts are for all clinicians also. What led you to invest your time, your money into that?
I think the first thing you said back there, I'm extremely curious, so I always want to get better. The other thing is, there's twofold. I felt that being respected as a chiropractor in Ireland, because we're not regulated, that if I had a master's in sports medicine, that it would look better on my CV.
Yes.
So maybe from an ego point, but I felt that the other professions might be more respectful of me. Oh, okay, Shane is a chiropractor, but then my signature says a master's sports medicine, so he has to know a little bit more than, there's got to be a rehab element to it. And then the other side of it is, like, we all know the Federation of International Chiropractic Sports, who is our umbrella organization for sports chiropractic. And then obviously the Doctor of American Chiropractic, or the DACBS, so there's the Doctor of American Chiropractic Board of Sports Physicians. The problem, those qualifications are great, but they mean nothing to outside our profession.
Right.
So one of the, like, I sat on FIX's, I was a European representative for FIX for 2 years, and actually Dale he was a non-executive on FIX's board as well back in the day. One of the reasons I wanted to do that, I felt that a master's, and being surrounded by other, because there was medical doctors on my course, there was physios, there was one other chiropractor, and opening their mind in terms of how we may or may not practice. So I think from professional integrity was also a big driver on it, and I love learning, and it was tough because I went back after 14 years, but I had to relearn how to academically write, critically appraise papers, and we all know since, like, even Greg, from when you graduated to when I graduated to now, this talk about the amount of research that's in our, even if you look at rehab or sports medicine, it's like drinking from a fire hose, and I would say it's even quadruple that now, or 10 times that amount. You simply cannot keep up with the amount of research, and beyond that now we're hitting into a very scary phase of where AI may have detrimental effects in terms of where these young clinicians mightn't, it doesn't matter what profession they can AI their notes. It may lead to sloppiness. It may lead, I don't know if it's going to take away from that curiosity where if everything is kind of handed to them.
So what advice do you have for them? Here's a chance.
You gotta fact check. I would probably go old as gold. I would reach out to practitioners that potentially have somewhere, the sweet spot for me is somewhere 20 years. Well, I'm 90. I would say probably 50. If somebody's been professional and they've been in a number of sports and they are in clinic, is to reach out to them what they should do. And the courses that have survived since the 90s, early 2000s are the ones you probably should do. Don't do anything that's flash in the pan. A good friend of mine always said, always try and talk to the horse and not eat the horse shit. In terms of, he said, he's a good friend of mine, he's a strength coach, and he always likes to go back to the original person. There's a lot of people that have, certainly in the last, let's say since probably 2010 to now, so it's coming up to 2010 to 2026 nearly, there's a lot of people that say that they have recycled. Now, some will give credit to their mentors previously, but there's a lot of recycling. It's like the whole self-help book section. There's lots of new books being thing, but if you actually go back to the old ones, they're the ones that they're the sound principles that these books are based on.
I think that's a great point. When I started studying and preparing my book, and those years that I put in putting it, getting ready to publish it, which came out in 2006, but I put a good 6 years in to working. And so I looked at the textbooks from all the way back to 100 years back, and I have them still. And I was amazed how many, I think, truths and things that were stated there very well. They didn't have the support, but they were observational. But so I wanted to make sure I integrated their wisdom into my book, and then add on and also give more support and bit more explanation. But you're right, and look, so for the today's students, I'm concerned about AI in the fact that it can make learning academically, presentations and getting information very, very. It can do it for you, but then you're not putting the time in to learn your skills and have a good foundation to be able to manage it. And so the shortcuts in the early stages can really cost you later on, and you end up having to put the time in to learn it and become a master. So in finishing up our podcast, I would just like to say that you have become a master because of your curiosity. You made your opportunities, you earned them because of your curiosity. I would say this is from what we've talked about, part of it is a tribute to your parents, to your mother, because she was the one showing you, having you read a book every month, which these kinds of things helped promote additional curiosity. They're foundational. And that in the end, there's an overriding theme of a number of our guests here on the podcast, of their curiosity and their desire to grow, their desire to improve themselves. And you made one point that I thought was excellent, that the students very often say, I want to be the best chiropractor. And what I would say is, what you have to do is focusing on being your best chiropractor. In other words, the one thing we can change is ourselves, and the one thing we should compare ourselves. And so
we were yesterday, as Jordan Peterson would say, you compare yourself
with ourselves.
Yeah.
And so this is very important. And I would like to thank you for being on our, today's podcast. I think that there's a lot of lessons to be learned from everybody, and I congratulate you on your growth. Please, and also the fact that your personal growth, your professional growth that I've seen over the past 15 years, Shane, and also with Karen and you two as a beautiful team, as a couple, and as clinicians. And that I have no doubt that you have become a real critical, filled in a real critical role in healthcare in your region because of the model that you've established and the foundation you've already set. So thank you for joining us.
Thank you for having me, Craig.
And bye everybody. We'll see you next time on ACES Optimus.
Thanks for tuning in to this episode of the ACES Optimus Show. Catch you on the next one.